Welcome to Embracing Life Again. I'm Catherine Coffer, transition expert and minister. Together, we'll break through life's toughest barriers, rediscover joy, and start dreaming again. It's time to embrace life fully with purpose, passion, and hope. Welcome to Embracing Life Again. I'm your host, Catherine Coffer, and with me is Liz Lyster. And so today we want to talk about, midlife, hormones, all these things. And so I wanted to introduce her, but before I do that, don't forget, the last 10 minutes of the show, to watch The Adventures of Theo and Zebedee. They're my pet therapy team, and we go out and we bring smiles and hope to people. So, Dr. Liz, she's a board-certified OBGYN with 30 plus years of experience. She's passionate about helping women and men in midlife boost their energy, balance their hormones, and achieve optimal health. A best-selling author and world traveler, Liz helps people in person and online feel their best so they can do their best. And I love that part of live their best so you do the best, because you do have to live your best.
Yes.
You do have to live your best.
Good.
Yeah. Mm-hmm. So we're probably going to make this 2 shows because I have so many questions to ask her. Let's start with the big one. What do you wish every woman understood about menopause that they often don't hear from their doctors? So, go.
Yeah, absolutely. That question reminds me of what I call the J word, which is the word just. So my patients actually say to me that their doctors say things to them like, you're just getting older, or you just have to deal with it, or you just have to accept it. And that's not true. I tell people to draw a circle and put a line right through the J word, okay, because that's just not the case.
Right.
It's actually the opposite. Menopause is a time where we can really transform ourselves. We can reconfigure how we want our lives to be. We can design our lives the way we want them to be.
Right.
Right. A lot of other things are happening at the same time that we don't have control over.
Right.
However, there is a lot that we can do to feel our best.
Oh, that's awesome. So what are some of the signs that our hormones are out of balance and that we need to see? Well, to me, she's not a typical OB. Right. Talking to her and knowing what she does, she's not typical. You're more on the holistic side.
Correct.
Right?
Yes.
So, yeah, I know when I went through perimenopause and menopause, that I'm on different hormone supplements, and oh my gosh, it's life-changing.
Yeah.
It really is, and I know some women are afraid of that. Right. So.
Right, exactly. Oh my gosh, just in the last couple things you said, there's a lot to talk about. Women have been afraid because they and their doctors have been under what I call the long dark shadow of the Women's Health Initiative study that started releasing results in 2002.
Oh, okay.
More or less, which is really, that's just an entire generation ago. And we're very fortunate that a lot of people are learning the truth about hormones, the right types of hormones given the right way, that can really, like you said, totally transform our quality of life and enable us to feel good and be out there. Right. So there's a lot of ways to do hormone replenishment, as I like to call it, that are safe, effective. So women have a lot of options, and the information is starting to get out there.
So it's not like our mom's pregnant horse urine.
Right.
Like
that's
they
right.
had how long ago. I don't even think they do that anymore.
It's around. It's Premarin. There's that one. That's the oral estrogen. And the problem is actually that it's oral. even more than the fact that it comes from horses. So it's like the farthest you can get from bioidentical.
Right. Yeah. So you do bioidentical.
Bioidentical hormone
Hormones.
replenishment. Yeah. So just replenishing. Our bodies used to make plenty, now not as much. And the symptoms, I want to talk about that. It can be very wide ranging and it can be very vague. So it can include things like sleeping issues, mood issues, weight gain despite doing everything else the same. These are I'm trying to think of the most like top common ones that women come to me. There are many.
Night sweats.
Night sweats and hot flashes, right? The whole musical, that was a fun
I'm
musical.
hot. I'm cold. I'm hot. I'm cold.
Yeah. Okay. So that's really well known, right? People know about that one.
People know that one the most.
Yeah. And also some of these, you mentioned the word perimenopause. That's really important. So the definition of menopause is 1 whole year without a menstrual period. As I like to say, not 11 months and 29 days.
Well, sometimes you'll get one after 10 months. It's like, what the heck? What
right?
just
Exactly.
happened?
And then the clock starts again, which is very annoying. But
Yes.
in any case, so that's when women go into menopause on their own. Of course, if they have their ovaries removed, that's surgical menopause. And that is also puts her at risk because all of a sudden she's lost a lot of the important hormones for our female bodies.
Right.
So that's really important. Okay, another feature of all of this is that doctors, we are trained to be focused on symptoms rather than underlying root cause.
So true.
So doctors give what I call Band-Aid medications. So you're having trouble sleeping, you get a sleeping pill. Yeah. You have trouble with mood, you get an antidepressant. You have irregular periods, you get a birth control pill. And those are, I'm not knocking those medicines. There's a place for Band-Aids. But they're not looking at the underlying cause. And so when women avoid replenishing hormones out of fear, that's where I really like to help. I'm not here to persuade anyone to replenish her hormones. However, I love alleviating fear, anxiety, and concern about it because there's so many good, safe options.
Right. And you don't have to be on a ton of them at the
That's right.
beginning. Don't you start low?
Absolutely.
One
Start
at a
low and
time
go
and-
slow. That's exactly right.
Right.
Yeah.
And I'm sure you take your blood.
That's right. Well, my process
the
is
levels.
super detailed evaluation at the beginning and then looking at the results and not interpreting, or I should say interpreting to optimal rather than did you barely squeak into the bottom of the normal range. So whenever any woman or man, I take about 10% of my practice is men, 90% is women, they say, oh, my doctor did some tests and they were normal. So in my mind, I'm putting brackets, I'm putting little quotation marks
Well,
around
we know
normal.
that because they don't. Okay, so when I go in for my physical, he's not testing my hormones.
Right.
He's
That's right.
testing, you know, my other things like my, I don't know. What is he testing?
Blood sugar,
Yeah.
cholesterol, really the
That's it.
basics.
Yeah.
Yeah, super basic, which is good. That's fine.
You want that.
Yeah. But we have to go way into a lot more detail. So fatigue, weight gain, decreased libido is really common. Besides being a fun one to help women with, it's really important because libido is not only about sex. It's your motivation, it's your drive. I had a patient recently who she was saying, I used to love exercise and now I just can't be bothered to get up off the couch. So part of her struggle with her weight is that part.
Was that estrogen or was that testosterone for
Oh,
her?
there's a few hormones. So estrogen helps.
Right.
It helps. Testosterone, of course, helps. Testosterone is the main reason that men have such an easier time with their weight compared to us.
Well, because they have more of it.
They have way more, like 20
more.
times more.
Yeah.
At least.
No, I know, but we need it, and
We
I
do.
don't think women know that we're supposed to have testosterone too.
That's right. That's
so
right.
when you're in your prime, how much testosterone does a woman have?
Oh, that's such a good question. You know, it really doesn't get measured very much. I'll tell you the range on most lab printouts is 2 up to about 45.
Mine was like 0.4
Yes.
when I got mine done.
Yeah.
Right. I still had a libido though, but
Well, there's
I
other.
don't-
Yeah,
I don't
there's.
get it, but
Sure.
now
well,
it's
we
up.
could say more about that,
I
but
think
yeah.
I'm up to like a 30-something-year-old, right?
Yeah, beautiful. Perfect.
Right. So
Yes. That's something that I talk about a lot, which is that when we replenish hormones, I'm going for a couple of basic things. Number one is symptom relief, because I just don't want women to suffer. That's number one. Number two is protect the bones. So when a woman tells me she's in her 50s, maybe she's reached 60, and she's feeling okay, and she didn't have any trouble going into menopause, by the time she's talking to me, something's happening. But I'm always worried about her bones. I'm like, okay, that's great, and I want you to get a bone density baseline. Okay, then we run up against the...
I don't think I've had that.
Okay, well, that's
No.
I really encourage
I have
women
not
to do
broken
that.
a bone, though.
That's good. That's good. We don't want to. I don't want that to change.
No.
So that's important. But a woman who's replenishing hormones to any degree is most likely getting enough for her bones.
Okay.
So that's really good. Yeah, and I have lots of women in my practice. They went into menopause, great, no problem, and then 5, 10, or more years go by, and then things happen.
Oh.
So all of a sudden, can't sleep. All of a sudden, things have really changed a great deal.
Wow. Okay.
Yeah. The oldest woman in my practice, she's in her 80s, and she just got married a couple of years ago, and
Oh, that's
she
so
wants to have a good
cute.
libido. I know, she's really great.
Let's have a good libido.
Right? Yeah. So there you go.
Okay. Then you have him on Cialis.
I don't she's trying to get him to come do an evaluation with me, and I haven't
I'm
yet.
just
But
teasing.
I know.
I'm just teasing, sorry.
I don't
just
know,
think
but I
it's
should
funny.
ask. I'll ask. Next time I see her, I'll ask.
It's so funny. I have to do a side note because it's really funny. But so I started dating again, which you just know now, but my audience kind of knows. And it's so funny because when you're doing it online, right, and then you meet them, they want to let you know they're functional or not. And that just like, well thank you for that. Great. Well, that's not what I'm in it for right now.
That's hilarious.
Isn't that funny?
That's kind of cute. You know, they're being very transparent.
But
Very
on the
upfront.
first date, it
funny.
just surprised me.
Okay.
I think it's hysterical now.
Okay.
But the first guy that did that, I'm like, oh my God.
Oh, that's so cute. I love it.
Yeah. And then they let you know what they want or what they don't want. But
Right.
So that will be another show.
another conversation another time.
Yeah, that's funny.
All right, that'll be fun. We'll definitely do that.
You had to know that one.
Okay.
So you wrote Dr. Liz, Easy Guide to Menopause. What makes your approach so easy? And how can women feel less overwhelmed by the transition? And
Yeah.
I don't know, I don't think people feel like shame of it that I know of, but how do they, like, you know what, it's just something something we have to go through, right? And let's do it the best we can. So it's not a hard thing. So it's not a thing that you want to go just bury your head and just not see your friends and not do anything because
Right.
you're like, at dinner the whole time.
Yeah.
Right? So how do you make it so easy, love?
Okay, that was the first book that I wrote, which
Right.
was a lot of fun writing. And it's really honestly more about perimenopause, which can be 10 or more years before a woman goes into menopause. So that's important to keep in mind. So the easy process, the subtitle of the book is 5 Simple Steps to Balancing Your Hormones and Feeling Like Yourself Again.
Okay.
Because that's the phrase that women use. I just don't feel like myself. I want to feel like myself again. Right? So there you have it. So it's really easy. The 5 steps. The first step is the super detailed evaluation. Way more than what most doctors run. That's the first. Well, the first step is identifying how you're feeling, because a lot of women don't realize that, like, if it's hot flashes or night sweats, okay, that's related to hormones. But a lot of times, if they're still having their period, even if it's occasional, the doctor says, well, you're still having your period, so it's not menopause, which is wrong.
Correct.
Okay, so number 1 is identifying symptoms. Okay, so we can say a little bit more about that if we want. The second is the detailed evaluation.
Okay.
The third is interpreting those results, like we were just saying. Not to, did you barely squeak into the bottom of the range, but are you at optimal? So that's interpreting. The fourth is the treatment, where we stay as natural as possible. Okay? When it comes to hormones, I actually avoid the word natural. I like to use the word bioidentical, because we're going for forms of the hormones that are similar or exactly the same to what our bodies used to make plenty of, and now not as much, and we're having symptoms because of it. And the fifth out of the 5 steps is the long-term follow-up.
Okay. My question that I have, that I still not sure I understand, is I'm on creams. So cream for estrogen, cream for testosterone, right?
Great.
If I go off them, do I go right back? Right? So
Yes.
Does it stop us from producing our own? I guess that is my question to you, because
Yes.
I'm thinking I'm going to stop. Right?
Okay, yes.
Oh.
I have a few things.
Yeah, clarify that, because I'm sure
Okay.
women want to know that you will. I think your body goes, oh, I have it, so I don't have to learn to make it again.
Okay.
But that's my interpretation.
Correct. It's very common. A lot of people are thinking that, so it's a great thing for us to talk about. I'm sure people watching are having the similar thought about it. And here's the difference. So for example, we have a lot of other hormones in our bodies that I also measure. Thyroid, adrenals. Okay. Our adrenals absorb the stress, help us respond to stress. Okay. And so first of all, the direct answer to your question is, when a woman is in menopause and she's using hormones and feeling good, and then she thinks that she needs to come off of them and comes off of them, her body the ovaries do not come out of retirement. Once they have retired, they stay retired.
Got it.
Another important thing to keep in mind is that half of all women, that's a lot, will continue to have the symptoms, hot flashes, night sweats, because a lot of women think, well, I'll just tough it out for a year or two and then I'll be okay. And that's not true for as many as half of all women who go into menopause. Also, something I learned recently, Catherine, that's so important. We lose the most bone mass during those years where we're going into menopause. This is kind of a new emphasis of mine in the materials that I'm doing and putting out there for women to know. So this is really important, because I always thought, well, first you lose your hormones, then you lose the bone mass. It turns out that that's not the case. We start to lose the bone mass as the levels are declining.
That
and
makes
then,
sense.
yeah, right, it really does actually.
Makes sense,
And so then by the time we're in the early part of menopause, we've already gotten behind the 8 ball. So women need to know, they need to be prepared. We're at a disadvantage because we have smaller frames. So more women get osteoporosis than men because we don't start with as much bone mass. Okay, all humans lose bone mass as we get older.
Right.
There's ways to mitigate that, but most people do. And so we're already at a disadvantage as females with smaller frames, and we don't want a hip fracture. I know women are afraid of breast cancer. We can talk about that.
Right.
But the impact of a hip fracture is so much worse. Thank God, most women survive breast cancer, but hip fracture has huge mortality in the first year. So we really don't want that to happen. It's so important.
Yeah, some people don't come out of the hospital after they break their hip. It's crazy. It's another question I was going to ask. So, with estrogen therapy, some people have been told by doctors, nope, causes breast cancer. Right? Or
yes,
you have
people
a
are
higher
told that
risk of breast cancer. And do you want to talk about that real quick?
Okay, I don't know if I can do it real quick, but I would love to touch on it.
okay.
We'll touch on it, and then we'll see how quick I can do it.
Yeah.
So I mentioned the dark shadow of the Women's Health Initiative study. That's the study that started publishing results well over 20 years ago now. In that study, they used the oral estrogen, the horse estrogen, Premarin. Turns out the problem was not that it came from horses, but that it was taken by mouth. So that's different. That's cardiovascular risk.
Okay.
So people are more and more aware of that, and doctors are aware of that. So with the breast cancer, those women were also given a progestin. That's not progesterone. Our ovaries make progesterone, but the women in the study were given a progestin, non-bioidentical.
So interesting.
That's the arm of the study. So it was hormones or placebo in that arm of the study. And there was a trend. It never even reached statistical significance, but they saw a slight increase in cases of breast cancer in that group. So they stopped the study and they put out a press release before they even published the study for doctors to be able to review. I will never forget when that study came out, because I was trying to sell my house and my realtor walked in and she was dripping sweat and beet red. And I'm like, oh, okay, I know what happened to you. Okay. And so it was really a difficult time for all concerned.
Right.
So that's,
oh my goodness.
So that was that arm. But there was another arm of the study that most people don't know about. It kept going. These were women who'd had hysterectomies. So the going understanding is that women who've had hysterectomies only need estrogen. That's not completely true. But that is still what doctors are taught, like in our training. And so there was the arm of the study. These women had had hysterectomies, so they weren't given for the progestin, estrogen or placebo. Guess what? The women getting estrogen had a lower incidence of breast cancer than the women getting the placebo. It was protective against breast cancer. That data came out a couple of years later, but it was too late. Everybody was freaking out.
Everybody remembers the first study.
Plus, there were other problems because the estrogen was oral. So really quickly, oral estrogen, anything you take by mouth goes down into your stomach and over to the liver. And estrogen stimulates the production of clotting factors. So in the study, there was a higher incidence of blood clots, stroke, heart attack. Not a lot of women, but the risk was increased enough.
That's crazy.
So that was a problem. But breast cancer was actually reduced.
Wow.
And then the last thing, and I don't mind, I could talk all day about this.
Anything to make them feel better.
Right? Here's what I want to say is that if estrogen caused breast cancer, all women would get breast cancer. And of course, that's not the case. The average age of getting breast cancer, at least in the US, is 68 years old.
Really?
And that's, by that time, that's when women,
earlier.
You would think, but it is not. It is when women have gone a very long time without the hormones in their bodies. That's the average age. So it's 1 out of 8 women eventually will get diagnosed, and that's over a lifetime. So it sounds like a lot, but actually, like each year at each age, it's not a high risk. Not like every year I have a 1 in 8 risk. That's not the case.
Wow.
Yeah, it's a lot to unpack, but most important is women don't have to suffer.
Got it.
We do not have to suffer. We can feel good. We need to feel good.
Right.
You know, the whole thing with mama ain't happy, nobody's happy. That's just true. It's just true. I mean, I wish I could say something a little more sophisticated about
happy wife, happy life.
Yes, this is just true. We have such a huge impact.
Right.
And so women tell me that after they feel better. I'm nicer to my kids. I'm nicer to my husband. I'm nicer to my partner. I'm nicer at work. You know, a longer fuse, right? Short fuse is another related symptom that women feel that improves when we have hormones replenished. I want to also say, you said something about like a level of a 30-something-year-old, which is really good. Even a 40-year-old, that's good too.
Right.
Because there's like a whole anti-aging, which of course what I do is anti-aging. However, a lot of doctors who are completely focused on the anti-aging, they do a lot more experimental things than what I do.
Oh, which I don't know what
right.
those are. Yeah.
And they're also trying to replenish hormones to the level of a 20-year-old.
No.
Which, as I like to say, there's a reason we don't want 20-year-olds in charge.
Yeah.
Right. Well, it just depends on who the doctor or practitioner is, because sometimes they just have that philosophy of like getting people up to super high levels, and it's not necessary. You can feel a lot better with really low amounts of hormone replenishing.
So I was a Kaiser gal when I started my perimenopause, and I loved her only because she's like, I wouldn't live without this. But this was an ester ring.
Okay, sure.
An ester ring. So what an ester ring is, it has estrogen in a ring, and it's like a diaphragm, but not. And you insert it for 3 months.
Yes.
And it helps your estrogen levels, but it's very low. It's only 0.5, I think. I'm not on that anymore. I've had to boost myself up.
Sure.
But I started that in peri, and it really helped
Nice.
my moisture,
Yes.
like during intercourse. Of course, it helped that.
That's right.
And that's what she told me. She goes, honey, you gotta have this. And so I did it for a while, but then
Sure.
When I got my hormone guy, which I'm probably gonna have her do my run my stuff now. So he's like, you're not getting enough.
Right.
So now it's time to do this,
Great. Perfect.
right?
Yeah.
So that might be a real quick thing to do to try and see if you have better results. I had phenomenal results,
Nice.
right?
Yeah, that's beautiful. A couple of things to
But
follow
I know you're
connected
gonna say
to that.
something. Yeah.
Yeah, absolutely. I mean, that just brings up so many important points for people to know.
Right.
Number one is it's not just dryness. When women talk about vaginal dryness, it makes it sound like it's the surface, like it's dry or it's wet on the surface. It's actually more, even more, it has to do with the underlying elasticity of the tissues. And that is why sexual intercourse can be uncomfortable, painful. Women can have itching, the pH balance changes. They can have recurrent vaginitis, like yeast infections or that type of thing.
Right.
So all of those things can start to happen. And also bladder infections, because the base of the bladder is the same tissue as the lining of the vagina.
Is that why? Okay, so when I go to independent living homes or rest homes with my horse or my dog, they all have bladder infections. Is that because they're not in estrogen or something?
Yes, that's exactly right. Yes. They're going to be of a generation where they're the ones who didn't get the hormones
My
or
mom
who got
needed
taken
it.
off of hormones.
But her doctor said, you don't need it anymore.
Right. Without realizing less colon cancer, less hip fracture, less breast cancer.
Right.
Okay. And another thing that you touched on that's important is what we were saying earlier, that the symptoms can happen before a woman is all the way in menopause.
Right.
So that's important. I'm so delighted that you got the right
That's why I said
choices
she
offered
was
to
good.
you.
She was really good. I
Yeah,
wouldn't have known about
that's
it.
beautiful.
And I told all my girlfriends, and they all went on.
Good. Right?
They all
Yes,
did. They're
yes.
like, woo. They're
Most of my
like,
practice is referral. They go to
like,
dinner.
woo.
My patient will go to dinner with friends, and one or more of their friends will be like, "Okay, I know who you should talk
okay,
to."
we need to talk to Liz.
Yeah, exactly.
That is too funny.
Yeah.
Okay. Well, let's get into myths of menopause, right? So what are the most common myths that you'd like to bust right now?
Yeah. Okay. Number one, we have said a lot about, which is that hormones cause breast cancer. So we've already done some good myth busting on that one.
Yeah.
But that's so important, because that's women's biggest fear, which I can relate to. My mom had breast cancer. She was 68, exactly when she got it.
Wow.
So I just, every time I go get my testing, I'm like, okay, let's see what happens this time. So I understand. I can relate to that. So that's number one. Number two is I'm done with menopause. Okay. Now
But we're never done though, right?
we're never done.
Because it's gone or it's not, right? It's gone.
I use the words menopause and postmenopause interchangeably.
Oh.
Okay, so we said menopause is a whole year without your period. And then the way I use the terminology is then you're in menopause. And that's it. You're in menopause for the duration.
Then
Okay,
when's post?
that's what I'm saying. Some women some doctors, they just call it post-menopause. So
Oh, okay.
Yes.
You don't call it post.
I don't. I just
okay,
say
okay.
it was before menopause and now I'm in menopause.
Got it.
Okay. And connected to that, we have a modern problem, Catherine, which is we live a long time. All right.
We didn't used to live
We
that
did
long.
not use, a couple hundred years ago, only 5% of women reached age 50.
How long ago?
Less than a couple hundred years ago.
That's true. Well,
Okay. So now half of us can expect to live into our 80s. All right. So that's like a third or more of your life in menopause.
yeah.
Okay, where the more time that goes by, the more bone loss, cognition. We haven't touched on that. That's kind of like the word retrieval. Okay.
It's like, I know that word.
That's right.
I know that word. Oh
Yeah.
yeah, that's the word.
Yeah.
But you have to think about it.
Yeah. And I went into menopause when I was 43, which is very young.
I was young
that's
too.
Pretty, yeah. So that's,
I think I was 45.
yep, that is young, right? Average age we said is 51. And as we're recording this, I'm getting ready for my 60th birthday. And I have used estrogen from the get-go. Okay, just like the first hot flash I had, I was at my office and I go, I know what this is. I was actually writing my book.
Oh.
I was in the process of writing my book and I had samples, right? I still had this physical office where I had samples. And so I went, I got a patch. That's important. And put the patch on and that was it. And I felt better really quickly.
Really?
And so we
So
talked.
we're going to have to talk about that too. The difference between a patch.
Yes.
All that.
Yeah, I wanted to put that in there because I talked about how oral estrogen can increase the risk of clotting in the blood, which can lead to other problems. Through the skin doesn't do that. It does not raise that risk. It does not have that first pass effect.
How about
through
an
the
injection?
Liver. Injection's fine too, as long as it's not oral.
How about
so
pellets?
injection, pellets, creams,
I want
patches.
Yeah.
Yeah, I've done pellets for a long time. I've done all of the things we're talking about. They're fine. They're great. They're convenient.
Doesn't it hurt?
For a second, you really should not feel much at all.
Really?
You really should only feel the doctor putting the numbing medicine. That's all that you should feel. And then you're done for 4 months on average. The way I do the dosing, women usually can go 4 months. Other doctors do it a little more often. Sure. Well, there's always lots to talk about, lots to learn. And people like you who are getting the information out there. Yeah.
Yep. Okay. So, what do you do for the women that are struggling with energy and mood swings? Is that a certain hormone?
It's really a combination. It's a combination. There's something, I like to use the analogy of a symphony, the hormone symphony. And another thing that's really important is that the conductor of that hormone symphony is actually thyroid.
Okay.
Thyroid hormone is the main area where doctors do one test, and if it's in the range, they tell you you're normal. Whereas my initial evaluation has 7 tests just for thyroid, and then also adrenals, which if we want, we can say more about that. Well, I'll just say super briefly that in medical school, we're only taught about adrenal failure or adrenal tumors, the extremes.
Whoa.
And there's this huge area in between, and that's where women get like the mood changes, the fatigue. Okay. And so that's really, really important. It's important to check them all out. Testosterone is also really important for mood, really stabilizing. I think that testosterone is the main reason that men look at us and they're like, what is the problem? Like, there's no problem here. Meanwhile, we're like, there's a problem. Right? Exactly.
I'm fine.
Or that. Yeah, that's a different problem to deny. I know. So that's really important. So mood, of course, mood is affected by sleep. Right? The first hormone to decline is progesterone. And that can decline in our 30s. As early as our 30s. For sure, by the time we're in our 40s, progesterone is declining. What does progesterone do? Calms the brain, helps with sleep, helps with anxiety.
Right.
Okay, so that's also related to mood.
But I take that orally. Is that okay?
That is okay.
Okay.
In fact, that actually does a
okay.
better job of that calming effect. It metabolizes differently. It's okay through the skin, but a lot of women do even better with oral progesterone, and that one is fine.
Okay. Good. I'm checking that box.
Yep.
What about, have they gotten better about, now I'm not talking about us, but birth control, oral birth control, is that a thing too? Because
yes.
I'm thinking that's estrogen and progesterone.
Progestin.
Okay.
Right.
So like if you have daughters or something and they want to know the best way to have birth control.
Yeah.
Is it is it still taking the, because that was way back when for me, right?
Yes.
Every 28 days you take your pill.
Right.
Every day you take a pill.
Exactly.
Or is a patch better?
Probably the patch is better. However, there's a few howevers with birth control pills. Number one, the doses are way higher than hormone replenishment therapy for HRT.
Okay.
So that's why a lot of women are given the birth control pill if they're having irregular periods and the hot flashes and sweats, and a birth control pill will help that. And it is oral estrogen, and that is a documented side effect of oral contraceptives, is an increased risk of clotting related problems, stroke, heart attack, that type of thing. The absolute numbers are very small.
Okay.
The relative risk is increased, but the absolute risk is still really
One
small.
per someone millions, right?
Yeah. So when I was doing my gyne practice, now I have entirely focused on perimenopause, menopause, and like I said, few men as well, because they're fun to help because it's more straightforward. The hormone symphony is
They're
less
just
complex.
easier to understand as a whole. We're pretty complicated.
Indeed. They have their depth as well, but yes. I'm with you on that. I agree. Let's see. So, what were we talking about? Or birth control pills. So when I was doing my gyne practice, I really would look at all the options with my patient. It's everything in life is risk versus benefit. Okay. And if an oral contraceptive pill is going to be a good choice for a woman to make sure that she doesn't get pregnant when she doesn't want to, that's really important, right? Pregnancy has its own risks. So that's just important. My whole career has been doing everything I can to help women have their agency, their own agency to be able to make our own choices.
Yeah. Okay. That's good. So, 3 tips real quick on, what can someone do now that they're not sure about, they think need hormone replacement? Who do they, I want them to go to you, right? But if they're like in a different city, they can still see you, yes?
Oh yeah.
Yeah.
I do most of my work online, so that's not a problem.
Okay.
Okay. So
she's just here with me. I'm sorry, but if you want to come to Reno, you can see her face to face.
That's true.
True.
Yeah, and the Bay Area, San Francisco Bay Area.
That's true. That's right. We're both from
Most
there.
of my in-person work is there. However, most of the time I spend consulting online anyway. So it's easy. It's not hard.
Okay. So
3 tips.
Yeah. What do they?
Okay.
What do they look?
Okay.
You tell me.
These are not necessarily in order, but the first one that's coming to mind is that I tell this to women all the time, is advocate for yourself. Or as I like to say, you have to be the tail that wags the dog.
Oh, sure.
Okay? So that's number 1. We could say number 2, it's kind of related to number 1. A good way to help you advocate for yourself is write down your questions. Be ready at the beginning of the visit with your doctor.
Because you forget. By the time you get there, like, I know I had a question.
Yeah, and the data's terrible. Like, there's studies that time the doctor and how long is the doctor talking versus the patient. And if you let the doctor start first,
forget it.
That's kind of, it could be a challenge. And then another important tip is to simply know, and women are getting very good about this, right? The internet is a mixed bag, right?
It is.
As I like to say, I've never seen anyone go on the internet and feel better. Because it's scary.
This disease.
Right,
Yeah.
exactly. You always have like the worst case scenario. However, women are getting themselves informed, and that's really important. And luckily, really very recently, a lot of doctors are coming around too. I don't know if it's because of all of the influencers that are out there that are just getting the doctors to get up to speed. But the things that you and I have talked about are things that I've known about for almost 20 years because I took myself to hormone conferences to learn more because what I was taught in medical school was so limited. All right. So as I also say, I'm still here helping women. At some point, it would be a lot of fun to go back to my medical school and see, or maybe even my residency program, and just make sure
See
that
what they're
they're
learning.
catching up here and up to speed.
Okay, cool.
I'm sure I'll think of more tips after we're done.
It's been
But
so
those are some
good.
good ones.
It's been so good to have you. So, how can my audience find you? What's the best way for them to find you? And then, is there anything you're offering today?
Best way to reach me is always my website, which is drlizmd.com. So it's drlizmd.com.
That's easy.
There's a lot of information on there. There's a contact us section on there. So there's a lot of information on there. And at this point in time, yes, people who reach out and they say that they saw me online or on a podcast, definitely when you fill out the contact form, mention that to get the special consultation that we do in that setting.
Okay. Very
I just want
good.
women to feel good.
Oh, I know. She's so sweet. So, we're done for now. We're going to do another one. But don't forget to watch Adventures of Zebby and Theo. Bye for now.
Coming up next, Adventures with Theo and Zebby, right here on Embracing Life Again with Catherine Koffer.
Okay, ready? Let's go! Catherine Kaufman. Isn't he cute? This is a mini horse. He's not a pony. Zebby is his name. And Zebby is a certified therapy animal. He visits many different homes. He helps people with their dexterity. He loves people to braid his mane. And how tall is Zebby, Catherine?
He's 38 inches.
So he's just a couple inches more than a yardstick. And he gives kisses. Yeah.
What are you doing?
Did he eat treats?
He's looking for food. You know that, right?
So what does he eat for treats?
He eats horse treats, which is little nuggets of molasses and carrots and apples.
And I don't know anything about horses, so where does he like to be petted?
His favorite place to be fed is underneath his chin and then on his chest.
I think he's found the treats in my hands.
Yeah.
And so he likes to be petted under the chin. And where else?
Under his chin, on his chest, on his back.
Okay.
He likes butt rubs too, but that's up to you guys.
Okay.
I'll leave that up to you.
My son showed miniature horses.
He does.
Yeah.
Well, I'm teaching him to cart.
Yep.
So we can cart with you.
They all cart, they show.
Yeah.
And what is his disposition?
Oh, Mr. Mellow Surfer Dude.
Are they all that way?
No.
Some of them are not as friendly.
They're not as, a lot of them are. I mean, a lot of them are friendly. It's really how you treat them, I think. Well, you're like, come here, come here.
Yeah. Just like any animal, right?
Right. So, but he was chill from the minute I got him. So he just has a chill personality. He loves people. He'd rather be with me than with the horses. So that's how I knew he'd be a really good therapy horse, because he has a healing sense about him. Because he cuddles up to you. And just,
You know, I asked that question because I had a Shetland.
well,
That
they're not as
Shetland was
nice.
the nastiest dog I've ever had. I was glad to get rid of it. Most of these breeds they do good with humans then, or what?
Oh, yeah.
They're friendly and not, they
Oh,
don't
yeah,
kick
and
and
they're
bite.
actually training them to be seeing eye dogs,
Okay.
horses
I'm
now.
really surprised to
Yeah,
see that.
because they can, they're little enough to live in your house. They
Okay,
can
I've
be
seen
potty
that.
trained. I have this just in case he decides. Yep. And then they lived about 45 years.
Oh, boy.
And they're more of a better height for people that are blind, right? So you're going to start seeing more minis be seeing eye horses. So,
And did you know that Arnold Schwarzenegger has a few of these animals? I'm not sure if they're ponies or horses or
No.
donkeys.
No.
They live in his house with
well,
him.
he would if I'd let him.
Yeah,
He'd probably sleep on my bed.
yeah, I'm sure. So the first time I met Catherine, I don't know anything about horses, so she had to tell me, she let me have the reins, and he started pitching a little bit of a, I don't like you very much yet. I don't know you, because he was trying to, he's pulling me, and I said, what is he doing?
He
He's
was
pulling
just
me.
testing you.
And she said he was testing me to see if I would give up. Look at that.
So when horses do that, they're releasing their stress if they're feeling any stress or anxiousness. So now he's just relaxing. He's not tired. He's just relaxing.
And what is the teeth all about? What is the teeth all about?
Showing his teeth?
Yeah.
Nothing. He's just yawning big.
So he's yawning when he does that. And when our dogs first met him, our dogs didn't mind at all. I thought we'd have dogs a little nervous because they hadn't seen an animal this big or a dog this big. They were all fine.
Yeah. And he's been trained around dogs since he was a baby. I've had him since he's 1 year old. I've been his only owner. So I'm all he knows, really.
Is 1 year old considered like a baby cut, like a puppy?
He's still a baby.
And adolescent?
Yeah, they're about 3 years to like 7 dog years. So they're about 3. That's why they usually, if they're healthy, will live until about 40, 45.
And how do you transport him around?
I have a minivan. I have a little wheelchair ramp. He goes in the minivan. That way I can go to hospitals, anywhere I need to go, because the trailer is too big for him. Big what? Oh, they love it. And I take him on hiking trails, and people are like, I thought that was a big dog. And then we have photo shoots on the hiking trail, because everybody wants a photo.
Yeah.
So, yeah. Thank you.
And he thinks he's only 20 pounds because when I first met her, he sat on her lap, like a lap dog. He literally went and sat on her lap. And I said, what's he doing? He says, he's just sitting on my lap, like a dog. And
He'll put his both hooves over me and just kind of. But he's 220 pounds. He is not a small dog. I know.
you're big on that. Yeah. And so would anybody do you want the people to come up here and pet him, or do you think it's better to just take him around?
I can do either.
Mom.
Okay, can we get
Did you see him already? Do you want to? Do you want to see him? Do you want him to come up to you? Okay.
do after me?
Sorry, this is slippery for him. That's why he has at least his front shoes on. Yeah. Okay. It's okay. Where are you going, sir? Because there's food on that thing. There's carrots over here. Oh, he must smell the carrots. Yeah. Hi. Get your feet going. Okay. And he won't bite. I always tempt him. He won't bite. He'll lick and chew, but he won't bite. You want to see him again? Pass him. Okay. You want to see him again? Okay.
Mom.
She'd like to pet.
Yes. Hold on. We should see if he likes wine.
I'm a pretty good bartender, dude.
Yeah, you might like it a lot. How's your day going? Did he make your day? He's supposed to bring smiles and hope. That's his job.
That's what I like.
It's a boy. He's a boy and he's 10 years old.
Does anybody back there want to see him?
Would anybody like to,
Anybody want to pet him or are you guys good?
if you want to pet the horse, raise your hand. And she'll bring him by. Remember, he likes to be petted under the chin.
Is there any food for me?
Oh, you're good. You're good.
Thank you.
Oh, you've gotten like 5 calls. I already.
Yeah, we're inside for that floor. So he doesn't. This is his little hiking shoes.
Oh boy.
That's a real unicorn, huh? From the dentist,
You guys want to say hi? What? Want to say hi? Sure. Hi, pretty boy. Hey, you're not done yet.
Therapy horse, huh? I like his hat. Does he keep those on?
Yeah, no, only on floors.
Only for what?
Only for those floors. I like his shoes.
Thank you. You ready?
You guys.
Bye, guys. You've taken the first step to embracing life again. Let's continue to break barriers, find joy, and dream without limits. Join us next time and let's discover inspiration through every transition together.